everybody, welcome to the second episode of Physio Podcast together with Mikulas Rehorik from Czech Republic and here use Patrick Celms from Latvia.
Yes.
Today we would like to discuss different topics and the first one, and that's my starting question for you too, is that because this module is about healthy lifestyle and lifestyle related disorders, what do you think? How would you explain risk factors? And in your opinion, what is the most dangerous one? Yes, you can start.
All right. So, two-part question. Lifestyle related disorders. So, there are habits that we take upon in our lifetime that are maybe not the most healthiest ones and potentially can lead to something that affects your life long term, such as pretty straightforward, like smoking or excessive drinking, drug abuse, but also things like sedentary lifestyle, for example, or gaming, which apparently now is a bright and upcoming risk factor for a lot of lifestyle related disorders. So it's not something that you can catch from someone. Like if you're lazy, I'm not gonna catch it from you most likely. But so your choices that you make in your life can lead to disorder that will affect how you feel, how easy it is for you to walk or breathe or think clearly in terms of that. In my opinion, the most, what was it, the dangerous one? Or, yeah,
The most dangerous one.
I think the silent killer is the sedentary lifestyle. I just feel it affects everything. How you use your joints, your body in general, how well your cardiovascular system develops or underdevelops. It's just not good for anything. I would go with the sedentary lifestyle. Yeah.
Thank you. What about you?
So I would probably start again, as JP said. You know, there's a lot of risk factors that are out there, which I feel, you know, a lot of people might be neglecting or just looking past that. I definitely think, you know, people, you know, grow up with certain habits, and these habits are really hard to get rid of, especially, you know, when you're involved in these habits since you're a little child, and then when you know, finally grow and get into adulthood, it's most likely that this risk factor is going to be somewhere in your background. You know, for example, if you use smoking or alcohol or drugs, whatever, but it doesn't necessarily have to be all these like addictive things. You know, it can also be the white killer, like sugar or something. You know,
Mm-hmm.
you might be, I don't know. I mean, you know, excessive use of vitamins as well. You know, you can. There's so many things that pose risk upon our lives, and I think that this module is, you know, since it's about health, this is what Fontes and this module is trying to tackle at, is the hidden risks under, you know, all certain like names. You know, it usually all the risks might be also hidden in like the grocery store, you know, as we said, sugar, gluten, whatever, everything. So I definitely think that the biggest risk factor, but the most dangerous one, is the one we cannot see. The one that we find is okay for us. Like, you know, for example, if you go, I've always lived by this a lot, that like if you feel tired or whatever, you can have like, you know, those little candies full of sugar and you will feel energized. Yeah, but that works if you know, do some sports activity or something. But some people are like, oh, I feel tired, I'm gonna eat something sugary or something. And that then they develop a habit. Whenever they're tired, they consume something sweet, right? And boom, there you go. You're developing a risk factor for diabetes, you know, obesity, or cardiovascular problems, anything like that. And those problems then lead into bigger things. So I think that the risk factors are in our daily life, and so we have to watch out for that. So that's my answer to your question there.
That's the reason why you came with a huge chocolate cookie today.
Yeah, well, yeah, well, you know, sometimes you just want a cookie.
Amen.
Do you have some risk factors present in your life?
Yes, I do. Um, at the moment, I think the biggest one is sleep.
Mm-hmm.
In a span of let's say a week, typically I sleep 5 to 6 hours a day, and then maybe 1 or 2 days it would be like 8, 9 hours. So majority of time I undersleep, if that's even a word. I undersleep a lot, and the thing is that at the age that I am at the moment,
Still
you,
fairly young, you mean, yeah?
yes, exactly. You really feel the difference when you sleep 5 hours a day
Yeah.
and then go on for a day where you're out of home for, I don't know, 10, 12 hours. And when you tackle your day with 8, 9 hours of sleep in your backpack. So for me, at the moment, yeah, sleep is the thing that I definitely have to work on. Is there anything for you?
Thank you very much for sharing. For me, I think that I lack some activity at the moment, even though that I visit the student sports center regularly.
Mhm.
It's only 1 hour usually per day. And then I'm mostly sitting behind my computer doing tasks to school, assignments, and so on. And in the end of the day, I just find myself that I didn't even have maybe 5,000 steps, not the 10,000 steps. So I believe that I should tackle this issue. Also, when you bike somewhere, again, you sit on the bike.
Yeah.
So this is me. Did this module help you somehow to realize that you have some risk factor present in your life and that you want to tackle it?
Well, since I'm very egoistic, I see that there is no problem with me. I'm joking.
It's not.
Well, no, definitely ever since we kind of started looking into this module, at first, of course, as module one, this previous podcast, which we, by the way, will link somewhere here, is, at first it was very like, what are we doing here? But then with time, each passing day, you start getting more into it. You start getting kind of the feel for what we're trying to tackle at and what we're trying to do. And so it made me realize that, yeah, there is definitely things that I need to work on. As a person who presents themselves as an athlete, there is also things like that I cannot do, or I should maybe pay more attention at. For example, I have to pay attention, also to sleep. I have to pay attention to my eating habits, so don't come to school with a cookie, apparently, I learned. Which I don't find such a problem, actually. Eating a cookie in a while, what's that gonna do, right? But I've definitely started looking into more, the digestive system and everything, kind of, because I feel that whatever you consume, you kind of are as well, So if, let's say, you eat a lot of junk food and stuff, well, you're gonna become one big hamburger and you're just gonna be, and I literally mean, one big hamburger. Not gonna, body shame anything, but it's just the truth. So it definitely made me realize that, I'm gonna refer myself as an example. I used to, whenever I'm with friends on a road trip and we want to stop somewhere to eat, what a better place to stop than at McDonald's, right? Because I mean, McDonald's, it's everywhere. It's something, and I take it as like, I know it's unhealthy, but I don't eat it that often. So I find it like, oh, I'm gonna enjoy a good meal at McDonald's. Why not? But I know that by doing that, I am kind of unconsciously setting myself towards the wrong path, which I actually try to eliminate now. So whenever I'm craving something like a cheeseburger, from let's say McDonald's, I rather say to myself like, what else can I have instead of that, you know? And most of these cravings come because you're hungry or you're bored or something, and that's also I think where a lot of risk factors come from. So I've learned from, to answer your question finally, is I learned that from boredom and from hunger you're making the wrong choices that lead to posing you to a risk factor.
Thank you very much for your answer. Thank you both for sharing. And right now, I would like to dive deeper into the lifestyle-related disorders. So, can you maybe explain what are they and where they can lead to, and what it can lead to?
Yeah, it's going back to the first question. So whatever we have already discussed, whether it's sugar, lack of sleep, or smoking, all of them can lead to permanent changes in your body, which would then classify it as a disorder for you, right? So, for example, I like the sugar. The sugar white killer is an amazing thing. I do log everything I eat every day, and of course there's sugar like in fruits and in like whole foods as well. But some days at the end of the day, when I look at the amount of sugar that I have consumed, it's madness. It's like everywhere. So permanently triggering your insulin and the resistance system in your body can lead to, let's say, diabetes, right? So that would be one link. You eat a lot of sugar, for example, that's not the only thing that can lead to diabetes, second type. But yeah, then you develop a problem that you can treat, let's say, only with medication. And that's the thing you want to avoid. And that is the most important thing to understand. This is the thing that you could have avoided if you made the choice. Nobody can make the choice for you. That's the behavioral change biggest difficulty. No one will force you to change. Never. And even if it looks like it's working for a week or a month, it's just waiting for the right time to derail you, and you will be back into your old patterns. So with the lifestyle related disorders, it is all about choices that I make so that my future looks as good as my present, if I'm, let's say, healthy. Yeah.
Okay. And
You know, sorry to interrupt, but I just don't think that it's, the question was like kind of what is a lifestyle, unhealthy lifestyle, right? Was that it? What is an unhealthy lifestyle that would lead to the risk factors, right?
the question was, what are the lifestyle related disorders
Oh, right, that's
which
the
can
one.
lead
Yeah.
the unhealthy lifestyle full of the risk factors, and yeah, that's it.
Yeah. So lifestyle disorders, right?
Mhm.
Like overeating.
Yeah.
Or undersleeping or oversleeping. That's
Oversleeping again.
that I think that's what we're more or less trying to tackle at, right? Well, I'm repeating myself over and over. Kind of this word is just stuck in my mind. This tackle, but it just suits this kind of problem the most, right? All the lifestyle disorders that we make our habits, like undersleeping, oversleeping, or uneven sleeping, even doesn't matter. It's like if you sleep one day 6, one day 8, then one day 4, and then more or less something like that, your body is just not gonna know when it can really rest, right? I mean, your body is a biological machine, which is programmed in a way. So that's why I think that the lifestyle disorders, not that your answer is correct, but incorrect, but I just think that we're more or less trying to tackle it of what are the lifestyle disorders that can lead to possible risk factors that can threaten your life, you know. So like overeating and stuff like that.
I sort of feel like it's the other
It's
way
the other
around.
yeah.
Like the
do
risk
agree.
factors lead to the lifestyle
Oh,
disorders.
well, that's what I mean.
Yeah.
Yeah.
Okay.
So that's exactly So
So, as already previously mentioned, for example, from Miki, that sometimes we don't even know that there is a risk factor present in our life. Do you believe that there is some correlation between health literacy and lifestyle related disorders? Is health literacy important? And what is it actually?
damn. Well, why don't you start this?
Yeah, well, it is, in my opinion, 100% in the core of everything. No health literacy or the basic understanding of how our body works um, leads to ridiculously and foolishly made choices in our life. I don't remember which of the teachers gave us this example, but for example, a conversation with a mother and the child that was visiting the physiotherapy practice that the teacher worked at, and asked, so what is like for the breakfast or for the dinner for the child? And she said potatoes. And so like, what
Oh,
form
yeah,
of
right.
potatoes? Well, yeah, it's a bag of chips. So here comes the health literacy. The lady thinks that's a vegetable, so vegetables should be good for my kid. But then comes the health literacy, like how are the chips made? What else is there? What kind of fats? What's included in the process of making chips, and how do our body digest that? And so, health literacy, it seems also almost, do you say utopian in a way that you have only one thing for the rest of your life since the day you are born, and it is your body. And I would go as far as tell that at least half of the world doesn't know basic things about how this works.
Absolutely.
So, would you agree that just because of our low health literacy, we mistreat our bodies without even knowing it?
Absolutely, I would agree with that statement, and I think this is also what where this module comes in for us as future physiotherapists. It's not about, okay, you have a pain in your knee, let's tackle the knee pain, but it's like, okay, do you understand the basics of human body? Sometimes I feel the treatment can worth not the worth of the treatment can be absolutely nothing and useless if the patient doesn't understand why even what I'm saying works.
Mm-hmm.
Yeah, I agree.
Thank you very much. Well, in this module, we also learn how to apply different communication techniques.
Yeah.
Do you believe that using the correct communication is a way how to tackle this issue with low health literacy? Or do you have to communicate differently with illiterate patient than with the literate one?
Well, definitely, I feel that communication is, well, at least for the physiotherapist, should be one of the core tools that they use because, I mean, being a physio also includes a little bit of, I would say, psychology, towards the patient. I mean, you have to listen, you have to kind of look at all the different, hand gestures, face expressions, the different, if the patient is sweating, if they're maybe shaking, if there is any sign of, just screening for red flags, I guess. And that's, I think, to your question, if you have to, approach patients who are known with health literacy and the ones that are not so well, kind of known to it, then I think you have to approach these people differently because, I mean, as JP said, I mean, some people may think that potatoes are healthy when they're as chips, but again, it's not only about the food they eat, but I guess it's also what they find healthy, so each patient, if they are known to health literacy, they might know like, okay, I know that my body needs approximately 7 to 8 hours of sleep, maybe. And some other people, according to other sources, would be like, oh no, but I can sleep only 5 hours. That works for me. And of course, that it might be the case. Some people need less sleep than others. But I think you absolutely have to, respect each person the way they are, but also guide them if they don't know exactly, what they're talking about, because that's what you're kind of trying to get at, right? If a patient comes to you as a future physiotherapist and they come to you with a problem that they know is a problem, but they refuse to believe it's a problem, then, that's when the health literacy from you as a physio comes. And you have to kind of explain, and it's not going to be in one sitting, of course. You have to stretch it for the long term, but yeah, I think there is a difference.
Mm-hmm. And then, how would you do it? Because you said that nonverbal communication is as important as the
Absolutely,
verbal
yeah.
one. The active listening of the patient is very important. Is there some communication tool or technique that you'd use for this, and how would you use it?
So one of the tools is the one that is also introduced in the model, which is motivational interviewing.
Mm-hmm.
For that, the base being A, you do not tell the patient what to do.
Why?
Because that is again something that you, in a way, forced onto the patient, rather than having a shared decision making, which is talking about different options and then choosing the one that the patient feels more comfortable with. And actually, I did also listen to a podcast 2 days ago where a physiotherapist is leading the podcast, and he invited a psychologist from UK to talk about behavioral change, how that happens, and why do so many physiotherapists lack in their ability to create long-term lasting change when it comes to behavior and health, lifestyle related disorders. And so a lot of times it comes back to our decision-making mechanisms in our brain. And the first ones we are introduced to are the ones we have in our childhood. And it is very simple. Without a choice, you do not make a decision. And a great example is, let's say you have a child and you need to cross the street,
Mm-hmm.
and you say the kid, give me your hand. And the kid says, no, like, give me your hand. We're gonna cross the street. I need to hold your hand. It's like, no, okay, give right or left. And suddenly you gave a choice. And the kid's like, okay, left.
Mm-hmm.
And this is the same thing that happens with adults. You cannot just tell them, well, you need to walk 10,000 steps a day, every day. Like, you just need to do it because I said so. Yeah, it's not gonna happen. But maybe if it's like, okay, walking or cycling, what seems more comfortable for you? And then the person thinks, okay, I have some power here. I can choose for myself. And that's where the motivational interviewing from different kinds of angles leads to. You give them the option to choose. Yes, you need to inform. Yes, you need to explain why all these options could be beneficial, but you allow them to choose. And from the podcast that I listened to, I didn't really understand where the physiotherapist got his education, but he said, well, we were not taught this.
Mm-hmm.
And so the conclusion was from the psychologist lady. She said, if you're a physiotherapist anywhere in the world, wherever you can try to learn something about how human brain works and decision making in our brain works, just take the course. Take the extra course for a day, for a week, whether it's online or in person. Just take it, and it will help you as a professional in your future career a lot.
Yeah.
Just because you understand not only how you work, but how the person that's sitting in front of you works in a way. Yeah.
Nice, lovely.
Thank you for the insights on the shared decision making. I definitely do agree that it is very important to make the decisions together with the patient, because in the end of the day, it's always the patient about who the whole process is. And do you believe, therefore, that it is a way how to avoid the relapse phase? Anything?
Avoid it. You mean with shared decision making, yeah?
Mm-hmm.
Well, I guess you could say so. I mean, to eliminate it, I don't think you necessarily like extinguish it from existence,
Mm-hmm.
but I think there is a less of a percentage to kind of come across it, you know, with patient. Getting it right.
I don't know if even there is a right answer. I feel like relapse is just a part of being a human. It can
Mhm.
happen whether
Yeah,
whether
well,
your treatment is forced upon you or you chose it yourself. When you step out the physio's office, there is a world full of distractions. So
and humans love restriction.
exactly, and it's about discipline. It's about getting up when you fall down. Very cliche, but that's true. And so failure once does not determine the rest of the path for your treatment. Okay, so you didn't do something 1 day or 2 days, acknowledge it, move past it, and keep going. Can you avoid it? Maybe, but I think everybody's so different, and you cannot control what the person does outside of the office. You can give them the tools.
Yeah, no, that's
But-
true. Absolutely.
Yeah. Do you think it can be avoided?
I believe that shared decision making can contribute
Mhm.
to less the probability of the relapse, but I don't think that it can be that it is a rule that if you're gonna use shared decision making, then the relapse phase is
Yeah.
not gonna happen. So
Yeah.
that is my opinion. And I think that I can summarize what we just said is that one of the important roles of physiotherapy is also mentioned in the KNGF. Professional profile is communicator, and the communication is the key. Again, cliche.
It is, but it's
But
true.
it is.
Yeah.
And I believe that as a physiotherapist, we should be competent in this area of communication, and therefore I'm very glad that Fontes and this physiotherapy program is trying to educate us on different motivation, on different communication
Yeah.
techniques and tools we can use. Not just the motivational interviewing or the shared decision making, but also, for example, ORS or the positive health forum we can use as a communication tool.
Yeah.
It's true.
Thank you very much.
Right.